Hello friends and partners, I am so glad to speak to you today on yet another opportunity to share with you what is happening in the ground here in the operations area in the DRC. My name is Dr. Paul Mulyamboga and I serve as the Director of Medical Services at Amigos Internacionales and the team leader of Doctors on Mission. I'm so glad and honored to speak to you once again. On behalf of the whole team of volunteers, especially our partners, Marie Claire Foundation, we want to say that God has enabled us to reach even more communities through contact tracing, surveillance, and also working with local authorities to ensure we identify the cases and bring them to the treatment centers and the isolation centers in the region. A few weeks ago, we partnered with Marie Claire Foundation, an organization in the DRC, which together with us have been working together in ensuring that with our volunteers on ground, we are able to do and support the government in contact tracing, in surveillance, but also in working with the community to ensure that we bring the community into awareness about what's happening, but also helping them to take control of the situation and also to embrace all the efforts the government in the DRC is doing to support the response of DRC in the eastern part of Congo. I'm happy to report to you that we have got strides that we can't report. We are seeing more patients coming and reporting to isolation centers, but also to the centers for treatment, but also more testing is being done right now. We are seeing more and more communities opening up themselves such that they can receive health care from the government officials and also from our teams on the ground. We are seeing more community dialogue. We are seeing more surveillance in the community. We are seeing more infection prevention and control measures in the community. We are also seeing even more treatment centers coming up with the support of several partners that we are working with in the eastern part of Congo. It's a privilege, it's an honor for us to be there, to partner with them, but also to share the love of Christ with them, which is the most important reason as to why we are there. Amidst of all the isolation from the rest of the world, God has sent us to the eastern part of Congo to partner with our friends such that we are able to bring the love of Christ to the people that need it most through healthcare. God is using this as a platform for us to actually be a blessing to them. A few months ago, the eastern part of Congo was hit by the Mulyamboga strain of Ebola virus. And as we have known in the past, we were among the first few countries to be affected because most of the patients, because of our porous borders, were able to pass in Uganda and caused some strains. However, the government of the country of Uganda has been able to manage it very well, and most of the cases have been treated, and the last patient was discharged home a few weeks ago. In the eastern part of Congo, however, the reality on the ground is far beyond what we ever wanted to be. These are the realities. Over 3,200 people as of today tested positive for Ebola. Of these patients, over 1,500 have lost their lives. They have died. And of these, we have a fatality rate of over 49%. More communities are being affected and more people are being tested positive. The good news is we have over 500 people who are in our isolation and treatment areas, and we have recorded success stories of people being sent home having recovered from the virus. This is a positivity because it comes of all the partnerships we have. We have been in position to see more people embrace the treatment, more people go away from the myth they have been having to actually seeking care. More families opening up for them to accept health teams to come and receive health care in the team and the community. We have seen that. That's a positive on our end. But it goes far beyond that. The needs on the ground are enormous, especially for the volunteers, especially for the health workers in the hospital, but even for the teams that are moving in the field, ranging from surveillance and all the community dialogues we're having. We do not just walk there. We need fuel to go there. Our teams need a vehicle to transport them there. They also need fuel to ensure that they reach the deepest of places for them to reach. Once they are in the field, they need to ensure that they have the protective gear they need to identify and to bring the patients to the isolation centers. They need the personal protective equipment that we do buy and we send to them. But also, they need other equipment that they need. Some of the gloves, others are masks, and even other things that we use in the treatment centers. We're supporting several other hospitals in Eastern Congo to ensure that they have what they need to treat all the patients that come. These do not just come out of the blue. They are bought. They are bought with funds that we receive from you, and that's why we come to you once again to give you a status report on what is on the ground, such that you are able to see what we are doing and you partner with us. We are calling upon you once again on behalf of the team of Amigos Internacionales and on behalf of all the partners in Eastern Congo that you will support us, you will stand with us, but most importantly, you will choose to give, to work, and to ensure that we provide this care to the communities that need it most in Eastern part of Congo. We would not be doing it if it wasn't for you. Continuously over the past, you have supported us, and we know that God has blessed you. We ask you again today to support us once again as we increase this work in the eastern part of Congo. On behalf of the whole team, on behalf of the organization, we want to say thank you to those who have partnered with us. We request those who have not yet to reach out to us and to speak to us today. May God bless you as you watch this.